Introduction to Obsessive Compulsive Disorder. Obsessive is a word often used to describe someone's intense interest in something. Obsessions are common and are not necessarily reflective of a mental health issue. Compulsive refers to rigid patterns of behavior. Compulsive behaviors are not deemed abnormal when they do not cause harm or distress. Thus, some people with ordinary obsessions or compulsions manage well. If you make zillions of dollars, for example, you can indulge in a few weird behaviors. No one will question you. But mental health professionals define these terms quite differently. In the mental health field, obsessions are considered to be unwanted thoughts, images, or impulses that occur frequently and are quite upsetting to the person who has them. Compulsions are various actions or rituals that a person performs in order to reduce the feelings of distress caused by obsessions. These obsessions and compulsions consume hours of the day and interfere with essential tasks of life. It is an obsessive compulsive disorder, or OCD, unless the obsessions and compulsions consume considerable amounts of time and interfere significantly with the quality of a person's life. The disorder debilitates individuals who have it and costs society plenty. Millions of people are held prisoner by the strange thoughts and feelings caused by this disorder. Between 1 to 2% of the worldwide population has OCD. And again, just to reiterate, that's around 2 to 3 million American adults are affected by obsessive compulsive disorder. However, many, about 60% or more, go untreated. Nevertheless, most people with OCD are bright and intelligent people, but doubt, uneasiness, and fear hijack their normally good, logical minds. OCD makes their brains believe that something horrible is about to happen. Those with OCD almost always struggle with one or more of the following concerns: shame, the intense desire to avoid all risks, and constant doubt. Because thoughts and behaviors of those with OCD are so unusual or socially unacceptable, people with OCD often feel deeply embarrassed and ashamed. The frightening, disturbing thoughts of OCD are not based on reality. People with OCD have these thoughts because their OCD minds produce them, not because they are evil or malicious. The OCD mind attempts to avoid risks of all kinds almost all the time, and we are going to go in this playlist through the different types of OCD and how OCD manifests differently in different individuals. Risks of all kinds abound in life. We know that, and no one can ever know when something horrible might happen. For example, illness, accidents, tragedy, war, grief, and ultimately, death. But the OCD mind tries to create the illusion that almost all risks can be anticipated and avoided. In truth, however, OCD does not provide significant protection in spite of extraordinary efforts to reduce risks. Accept a certain amount of risk in order to live a full life. Doubt permeates the OCD mind. It's difficult to be 100% certain of almost every single situation in life. Someone with OCD often has worries such as, am I sure I locked the door? And then checks 5 times. Is it possible that I might lose control and shout obscenities? Could I actually be sexually attracted to animals? If I don't alphabetize my cans or put them in chronological order, will I be able to function? Am I sure that I will not harm any of my children? Indeed, with thoughts like this, who would not be worried all of the time? People with OCD suffer. They are more likely than others to have other emotional disorders, such as depression or anxiety, which are other mental health disorders, and due to embarrassment, they often keep their symptoms secret for many years. The pain of OCD is accompanied by loneliness, for OCD disrupts relationships. Interestingly enough, statistically speaking, people with OCD are less likely to marry. And if they do, they are more likely to divorce than others. And then those who do actually continue on in their marriages and with their families often have more conflict than those who don't. Someone with fears of contamination, for example, may be late for work because they cannot get out of the shower quickly enough because of excessive washing. A person who believes that they may have possibly hit somebody with their car may circle around multiple times to check, or may get lost and not know how to get to where they're going, resulting in once again being late for work. Someone else may have to recheck that door and make sure it's locked multiple times. A person who has a need for perfection may not be able to turn in completed work in a timely manner, or may turn it in before it's due because of repeatedly checking for mistakes. And someone else with a need for symmetry may spend endless amount of time and hours arranging their desk. The outbreak of COVID, for example, exposed everyone around the world to potential infection, illness, and possible death. Imagine the terror that was caused by COVID to those who already suffered from the type of OCD that fears contamination. And so OCD tends to get worse when people are stressed. And COVID-19 did not help. If you spend loads of time cleaning, you may be doing yourself more harm than good. Scientists actually now believe that excessively clean environments may actually be causing an increase in allergies. However, that's not to say that people should not stop washing their hands. I do want to give a disclaimer here in this video that I am not a clinician and I'm not a psychiatrist, I'm not a clinical psychologist, I'm not a licensed therapist, I'm not a doctor in any way. I don't have a medical doctorate, I don't have any kind of practice in osteopathic medicine, nothing like that. But this information does come from Laura L. Smith, who has her PhD and is a clinical psychologist. Now, to continue on, there are several treatments and options for OCD. If you had OCD during the Middle Ages, for example, you very well may have been referred to a priest for an exorcism, or you might have just been burned at the stake. The strange, violent, sexual, or blasphemous thoughts and behaviors characteristic of OCD were thought to derive from the devil or evil spirits. And if you had OCD during the dawn of the 20th century, you may have been sent for treatment based on a Freudian psychoanalysis, which purportedly resolved unconscious conflicts from early development. For example, if your OCD involved sexual obsessions or compulsions, you were assumed to have unconscious sexual desires for your mother or father. In fact, the common use of the word anal to describe people who are overly rigid, controlled, and uptight came from the Freudian idea that strict early toilet training caused children to grow up with excessive concerns about neatness and rules. However, neither exorcism nor psychoanalysis ultimately proved to have much impact on OCD. Only in the last half century or so have effective treatments evolved for OCD, and some of these treatments have only become widely available quite recently within the last 20 to 50 years. Major treatment options for OCD based on scientific studies include cognitive behavioral therapy, or CBT for short, metacognitive therapy, MCT for short, mindfulness, also exposure and response prevention, which is ERP for short, medications like SSRIs, which are serotonin reuptake inhibitors, and then there is deep brain stimulation as well. Cognitive therapy was developed by Dr. Aaron Beck in the early 1960s, and it is a major component of cognitive behavior therapy. Originally, this approach was used to treat depression. It was based on the idea that the way you feel is largely determined by the way you think, or the way you interpret events. And again, that harks all the way back to the ancient world of Epictetus. After you have identified distortions, then you can learn to think in more adaptive ways. Cognitive behavior therapy, or rather cognitive therapy in general, was applied quite successfully to anxiety disorders, eating disorders, oppositional defiant disorder, and even, to some limited schizophrenia. The cognitive therapy component of cognitive behavioral therapy has been found to be quite effective in treating obsessive compulsive disorder. Usually, cognitive behavioral therapy includes at least some elements of ERP, and again, ERP is exposure and response prevention. And of course, some practitioners believe that applying cognitive strategies first may make the application of exposure response